and we're going to listen to the lungs. Now, I have my own fancy human stethoscope, but the intake center has stethoscopes also. So, we've palpated the baby's belly. We've palpated the bladder area. Now, we're going to feel for ribs along the sides. Again, 2, 3 fingers, really, really gentle as you palpate those ribs. It is not uncommon for a little mammal who has fallen from a great height, like a squirrel or a rabbit, or if a cat or dog caught them, to have a broken rib. And that's going to affect their ability to breathe. So you want to note that so that you can really keep an eye on it. So again, I've got 3 fingers, and I'm just gently feeling along the baby's rib cage. Now, I don't feel anything on Mr. Bunny, so that's a good sign. So now we're going to put our stethoscope in, and we're going to listen to the baby's lungs. Ask it to take a deep breath. And listen to the other one. So what you're listening for, what am I listening for? Well, normal lung sounds, you just hear air. Air comes in, air goes out. But if you're hearing little Rice Krispie sounds, crackles, that's fluid. Fluid in the lungs, just like people, bad, needs antibiotics. The baby probably aspirated, meaning choked on its own fluid along the way. So that baby needs to be treated with antibiotics because that develops into a very nasty pneumonia and can kill the baby. So now we've listened to the lungs, and the lungs sound good. Let's just take a listen to the heart, make sure it's beating regular. Heart's right over there. Oh, heart sounds great. Okay, so now we're going to gently cradle the baby, and we're going to feel the baby's spine. Real gentle. Look at my fingers. Super gentle. 3 fingers. All you're feeling for is any kind of, if the baby jerks or reacts, you hit a hot spot, go slowly. Be very gentle. You don't need a lot of pressure to elicit a painful response in a mammal who's had a broken bone, just like if you would, right? So again, you just have to go up and down once, and then that's going to lead us to the bunny's tail. Now, this particular bunny doesn't have a tail, but we're going to pretend the bunny has a tail. So if your baby has a tail, you want to just gently palpate that tail in between your fingers. Number 1, are there any hot spots where the baby jerks or pulls the tail away or yelps? That's bad. An injured tail, they can get over that. We can treat that and it will heal, but we need to know about it. A bad tail can affect their balance. So we need to keep all that in mind and notate anything. When you're looking at the tail, also look at the fur of the tail. Are there any spots missing? In fact, when you're checking the baby, you're going to give it a general skin exam. We have skin, they have fur. So you're going to give it a general fur exam. Is there mange? Are there patches that have fallen out? Are there torn areas? Are there any cuts on the baby or lacerations that we need to repair or keep an eye on? Those are all important signs. Now, we're going to look at the legs. Do the legs move normally? Bunny's legs move normally, but your critter may have a leg that doesn't move very well, and it kind of walks around on 3 legs. So take that leg gently and palpate it, top to bottom. Just feel along. If you feel Rice Krispies or crunchy, don't press hard. That's a broken bone, and the baby should recoil their leg away from you, just like you would do, okay? If they don't, that could mean that there's also spinal damage, and they've lost nerve sensation, and they can't feel you touching them. So just be aware of that. So look for limbs moving normally, limbs dragging, limbs hanging, and then gently, with several fingers, palpate each limb, just like you would do if your child came up to you and said they fell at the playground. You would start at the shoulder, and you would gently work your way down, and you would move the shoulder, and you move the elbow, and then you gently move the wrist and the fingers, and that's how you would examine your child. And that's how exactly you need to examine your little baby critter, okay? So now we've gone over the tail. The last part we're gonna do is the genitals, okay? So little tiny mammals, before they open their eyes, they need genital stimulation to eliminate. Mommy does this by licking their genitals with her tongue. We do not expect that at the intake center, and we don't do that either. But what you can do is you can either get a little cotton ball and moisten it with warm water. I use a Q-tip moistened with water, and you just rub that Q-tip over and around the genital area. Again, be gentle, but make sure that the baby feels it. It's the stimulation that produces the baby to defecate and urinate. So that's what you want to do, because looking at urine and poo in a mammal is very important when you're doing a physical exam. In humans, if we get dehydrated, our urine turns very dark because it's concentrated. Same with a mammal. Your mammal's pee should be nice and clear and yellow, just like yours. Our poop is brown, but when we're babies, our poop is yellow and soft. Same with little mammals. Their poops are little tiny yellow pellets, very soft, very small. So that's what you're going to get on your Q-tip, and you want to make sure that the baby can eliminate, okay? Once the baby's eliminated and you've looked at the urine, you've looked at the stool, you've checked your little mammal's bottom to make sure there aren't any sores or blood around the anus, to make sure there aren't any maggots or obvious insects around the anus or genitalia area. Again, you can clean that with a nice warm wet cotton ball and just get those insects off of there. And then obviously contact another rehabber to find out where we go next, because we may need to examine the stool or examine the urine. It's also important, obviously, if you see blood in the urine, because that would indicate an infection. So we've covered the basics, and I hope this will give you a little comfort in how to examine your beloved critter that you're going to take care of. We appreciate all of you volunteers and all the hard work that people do keeping wildlife wild. And we thank you for your time and for paying attention. Take care.